So I think almost all people have joined. So we can start the meet. So a warm welcome to all. Good evening to all. So here we are. We are just starting one of the talk series titled "A Day in the Life of Neurosurgeon" with Dr.Dhairy. So this is presented to you by ESIC Sign. So just to tell about what ESIC Sign is, ESIC Sign stands for ESIC Student Industry Group in Neurology. So it is a small group which was started in our college just for the sake of people who are interested in neurology as per se. So under this, we hold many events like John Clubs, Neuro Tales, talking with experts, having a day in their life. So that is the main gist of our thing. So before we get into the main event, I just like to welcome Mayuga V, a member of our team, to briefly introduce the speaker.
Am I audible? Hello?
Yes,
Hello.
you're on.
Yeah.
Good evening, everyone. Today it is my honor to introduce a doctor whose journey represents resilience, mentorship, and dedication to helping others. We are privileged to welcome Dr. Dhairy Boghani, a doctor, researcher, mentor, and writer who has inspired thousands of medical students across India through his work in education and guidance. Dr. Dhairy Boghani completed his MBBS from Government Medical College, Bhavnagar, and is currently pursuing neurosurgery training at Jubilee Mission Medical College and Research Institute in Thrissur. Alongside his clinical work, he has remained deeply connected to academic research and student mentorship. During his medical school years, he actively participated in research and was selected for the prestigious ICMR short-term studentship program, which marked the beginning of a strong interest in medical research. Beyond academics, Dr. Boghani has also dedicated himself to social impact. Through counseling and mentorship, he has helped many individuals struggling with emotional distress and suicidal thoughts, guiding them toward hope and recovery. He has also organized free medical camps, health awareness programs, screening initiatives for hypertension and diabetes, and educational activities for communities. Through platforms like Quora and mentorship initiatives such as Know Your Calling and Knack of Knowledge in MBBS, he continues to guide medical students on research opportunities, career choices, and the real journey of becoming a doctor. Today, he joins us to share insights from his journey and give us a glimpse into a day in the life of a neurosurgeon. Please join me in warmly welcoming Dr. Dhairy Boghani.
Yeah. Hello. Thank you so much for your introduction. Happy to come here and talk to all the people who have joined here. So welcome everyone.
Yes, thank you, Mayuga, for the introduction. So I think we can get into the event. So what we planned was just an informal talk, not too formal, just to get to know about what happens in the life of a neurosurgeon, because everyone
Yeah.
is so fascinated when they hear the word neurosurgeon. So about that. So doctor, if you could tell during your MBBS years, so when did you develop this interest of neurosurgery? Like, did you know it when you joined your MBBS, or was it along the path? If you could just tell on that and your MBBS journey, it would be great for us.
Yeah. So in the beginning, I was like fascinated about doing some good research work and some challenges. I was always fascinated about challenges. So initially through first year itself, like there are few challenging branches and neuro will be like neuroanatomy, neurophysiology with the most challenging work. So I was fascinated about neuro. Then when I entered into the OT, started in the OTs, then I was always like wanted to become a surgeon, do something with my hands. So that's where the idea of neurosurgery came into my mind. But I won't tell like it was like I was always wanted to become a neurosurgeon from the beginning. But then my second year, third year, I used to talk to a lot of neurosurgeons about their life and like how it goes, how it works. So then I decided that okay, this is what I want to do in my life. So sometimes it's like we think that we want something, we want to do something, but ultimately we also want to correlate it with a real life scenario that actually what we see from outside is actually matching from what they are living. So that's how I came to conclusion that okay, I want to become a neurosurgeon.
Yes, doctor. So, was there any particular experience during your MBBS journey that made you think, yes, I want to take this branch, I would like to go into surgery, then take neurosurgery? Any such experiences you had in your MBBS journey?
Uh, not such a like a big incident or something, but yeah, always going into OT theater and seeing the surgeons operate. That always fascinated me. So that's where like I was always like neuro was one of the my most interested like most prominent interest area. But after going to OTs, I decided okay, I want to become a surgeon rather than a physician.
Yes, doctor. So, doctor, if we just went through your portfolio, like, what all you did, it shows that you did an ICMR STS during your time. So that project, so do you think that BBA students at this time should engage in research activities, or did that project also was a factor for you to choose neurosurgery? So could you tell us about your project time during the ICMR selection?
Yeah. So basically, in India, that research is completely like not related to our academic career. Only as a part of our PG journey, we do thesis, that's all. Otherwise, it is not a part of our academic career. So to become a neurosurgeon, I won't say that it's a must. It's a like a part of that thing. But for becoming a good neurosurgeon, I would say definitely you have to get exposed to a lot of good clinical research work. So my journey was like I always wanted to do some research work from my beginning of first year. I applied for ICMR in first year also, but due to lack of knowledge and things, and I couldn't get into my first year. And I didn't have that much guidance also in my first year about research project. So when I got it into second year, I was like I worked a lot on that project and I got it selected. So and since then, I have done a lot of research work, and I've had a lot of students doing their own research work. So basically, what I feel is, if you know how to conduct a research, and if you know how you can play with data, then you can understand how people are playing with data, like other people are doing something, some papers are coming, some pharmaceutical these companies will come and show you that this drug is helpful. But if you know how to do conduct a research and if you know how to read an article, then you can understand better that okay, what they are saying is correct or not, so you can utilize all these things into your practice. So becoming a good clinician, definitely research is one of the most important part. And if you are planning to go out of the country, like you are going through USMLE pathway, or you want to go for any other country for that matter, in that, research is the most important part. In USA, I think for USMLE, people who are getting into medicine generally, on an average, they do two or three published paperwork. But people who get into neurosurgery, they do 17 to 18 on an average published paper. They do have that much of the research work behind them. So, and that is the most difficult branch to get into residency in USA, the USMLE pathway. Very few people from India I know who have got into the neurosurgery residency in USA.
Yes, sir. As you rightly pointed out, yes, that is also a part when you go to abroad. So just coming to neurosurgery aspects. So as we all know, neurosurgery is a pretty demanding specialty because of the long work hours. So during your residency period, so what was, I think currently as you are going to, you finished almost 5 years. So what is the one thing that motivated you during your MBBS time and now to just keep on going despite all these challenges which you have faced?
So as I told earlier, I used to love challenges. So that is the one of the most important part. But when you join residency, one of the most important thing I will tell you is like you see the results in front of you. You save lives. Like I will, if you want, I will share you two, three experiences of like my residency. So one day I was on 24 hours duty, and like after 23 hours got over, one girl, 26-year-old girl, bought dead, bought into unconscious state into our emergency department. we started resuscitating her, and we and that got successful. We got her back to the life, SLS protocol. Then intubated her and took the CT. CT showed a very big hematoma. Initially, we thought already patient went into arrest. We shouldn't like attempt anything aggressive. We should see what happens. But then we thought, okay, young girl, at least we will see what is there. So we took a CT scan, CT brain, CT angio, and we showed AVM. So once we admitted her, after a few days, she started responding a little bit, like just eye, a little bit eye opening, flicker of movements. Then we got some of after a few days we operated on her and they exercised the AVM. She started improving, and after 3 months she went back to her job with no deficit, nothing. Now she was some government officer. So say after 3 months itself she went back to her job, and now she is living complete normal life. The story, there was one 7-year-old boy who stayed into ICU in a coma for almost 20-25 days in a deep coma. But now he is going out, like now he's completely going to normal. He's completely normal and going to his school, attending his all these normal activities, and he can do his own things by himself. Like there is no deficit or nothing. You can find out that by seeing him, you can tell that okay, he had a past history of brain injury after staying lot of days in ICU, and almost like even it almost went into uh, near the death. So those type of stories we are like regularly we are seeing, we are experiencing. So that's what help us keep on going despite all the
Yes.
challenges we face.
Thank you for sharing those stories. It's interesting to hear directly from a neurosurgeon.
So one
Uh,
thing, like I'll share one perspective, not just about neurosurgery,
yes.
but in general, like what I feel is if you are doing something significant work, some people tell like neurosurgery has a lot of mortality. Yeah, patient die. A lot of patients die in neurosurgery. But because we like if 10 patient comes to us, maybe like out of 10, we can save 9 of them. If we don't intervene, almost 9 of 10 will die. If we intervene, maybe we can save 8 out of those 9. So that's where actual power comes. If you choose a branch like dermatology, I'm not saying any against any branch, but if you choose a branch like dermatology, which is more of a inert branch, so people won't die, you won't save the people. So when you have people who are like coming to you and they are about like they can have a very high risk of dying without intervention. That's where you can intervene and you can actually get a feeling of saving lives. So what I feel personally is like neurosurgery, cardio. These are the branches like where you get to life and death situation every day, almost every day. So if you like, it's all about appetite of risk taking. So that's how you can choose your branch.
Yes. So, as the title of the event is a day in the life of neurosurgeon. As you told about these stories, can you just tell about morning to evening routine, what you follow normally? How, at what time you wake up and what time you go and what comes in between?
Yeah. So actually, we are on duty 24 into 7 almost every day. There is no off duty or nothing like that because any patient can go bed any time or anything can happen. So generally, when we have alternate day, either we are on duty that day we take admissions and we catch up with all the emergencies. Another day we have operation theater day where my colleague will manage the emergencies. So alternate day we have the type of schedule. So when I have a routine emergency day, then wake up at around 6:15 and go and take rounds in ICUs. Then consultants will come, will present rounds to them and take the decisions. Then in the rounds, we will have some discussions about like patient management, what all things to be done. After that, maybe we'll have a coffee and go to OP, outpatient department, and we see almost 30 to 40 patients in a particular outpatient department. Then there also like in between we are on the emergency call also. So if someone comes in emergency with any of the head injury or spine cases, we have to go and see intermittently. So after OP gets over by afternoon, you can have sometimes you can have lunch, sometimes it is delayed, sometimes we can't have. And after that, we'll go for that seeing the peripheral consultations like other department we are which are admitting the patients like neurology. They were made something and from imaging they find out something surgical is there or some other departments find out something neurosurgical. So we go and see those consultations. Intermittently, those emergency calls keep on coming. And then evening again, we take evening rounds and brief all the relatives about our ICU patients. And then at night, anytime cases can come in emergency. And, like in neurosurgery, there is like, uh, nothing you can take for granted. I've seen few patients, like one patient came to our emergency department with looks like a minor head injury. This is just a fall, slip and fall in the bathroom. Young patient, no comorbidities. So they also thought, okay, one episode vomiting is there, nothing is there. And it got a little bit delayed because of lot of other patients and uh, hurry and all. Then suddenly, like once they have taken CT and CT showed a very big EDH. So EDH is one of the dire emergency for us because that's where we have to go and immediately operate. We take the patients into operation theater within almost half an hour, 30 to 35 minutes. We do all the blood investigations, prepare the operation theater, prepare the anesthetics, everything we take and we take them under the knife for under 35 minutes, 40 minutes generally. So like this patient was like suddenly CT में that was EDH and they called me that so some case is there they are showing some EDH and after listening to EDH I just ran to emergency department and the person who called me told that patient GCS is for 15 by 15. Once I reached there, I just started talking to relatives what happened and I reached to patient within almost 4 to 4.5 minutes from the time that emergency doctor called me. In 4.5 minutes, the patient had a GCS of 7 or 8. That's how patient can deteriorate. So then in our ICU also a lot of emergencies keep on coming because patient can throw seizure, they can bleed. Lots of emergencies can come in neurosurgical ICU. Also non-neurosurgical emergencies also keep on coming because lot of old age patients coming and polytrauma patients who have chest abdomen injuries also. So typically we manage all these emergencies and next morning like we'll have the operation theater plan. So according to plan, maybe 2, 3 cases. Generally we have 2 to 3 cases per day for operation theater schedule. So our cases generally run from 3 hours to 14 hours, 16 hours. 3 to 8 hours is our normal time for a single case. Less than 3 hours, very few cases are there which will finish less than 3 hours. And few cases run more than 10 to 12 hours, like CP angle and all. So generally on operation theater day, we'll like again we'll go early morning because consultant will also come early on those days. They will also because of the case, they will also be stressed a little bit. And fatafat say we'll finish off the rounds and go to operation theater. And once cases are finished, we shift the patient out to ICU. And that day we have monitoring duty because our post-op patients are very much fragile, especially cranial cases, tumor, vascular cases. They can go bad anytime. So the post-operatively we just monitor them and keep on checking on them, like if they are fine. Sometimes we just say if patients are stable, we'll just from home we'll call sisters and ask about the condition of the patient. And again, next day again emergency will start, duty will start.
Yes, it is pretty hectic workload as you told.
Yeah.
So, main question that comes to neurosurgeon or any clinical branch is that how do you manage your work-life balance? So, do you have any such sort of problems like too much work is there, or like how do you manage on your work?
So basically, the most important principle in managing work-life balance is there is no work-life balance in neurosurgery. It's all work-work balance. I'm not telling we don't have personal life, but that concept about work-life balance that we should have this many hours for our me time or this many things we want to do on this time and all. Those type of concept doesn't exist in neurosurgery. So people who are like ready to dedicate their life to neurosurgery should only choose because you have to learn how to enjoy your work and then only you can work in neurosurgery. Providing that I like I have I'm interested into writing poetries and I'm also family man. I'm married, so I get enough time to spend with my family and I also see watch lot of movies. I go on the tour. This all things happens, but it's not like a particular timeline that you decide, you plan everything that okay today this time we'll do this or after 8 hours the duty is over. It's not like that. Some days you don't post any case and you can get a free day. Sometimes your case get over early. Someday on emergency day itself, you don't get any cases and you can read a lot. So and some Sundays are free. Then we have a teamwork. So some days my co-PGs are managing things. Then I can have a free day. So most of times like you will get your own time. Like whatever you want to do, you can do. There is no like restriction like anything. But yeah, it's not about managing work-life balance. It's all about enjoying work and finding out, picking out your own windows to do your own work and fulfill your hobbies, spend your time with your family.
Yes, as you pointed out, work-work balance. So, sir, one more thing in neurosurgery is that it has a, everyone says it has a long, steep learning curve there. So, what was the most challenging skills you had to master during your training or during your entrance time to go into neurosurgery as such? And do you still keep reading or does it ever end in the neurosurgery?
Yeah, yeah. So I will answer into two parts. One part about reading. Reading is like you can never leave reading in neurosurgery. Like you just one example, like if you ask who reads maximum, then maybe people will tell like medicine people read maximum, they have biggest books and all. Out of medicine people, if you ask like which specialty read maximum, then they'll tell neurology because they read a lot. But as a neurosurgeon, despite all these work hours, you have to read more than a neurologist. Sometimes like if you think there is some spinal case which has two-level disc. So if you're a neurologist, you can diagnose okay, L3, L4, L4, L5, two-level disc is there, and your treatment will be same. As a neurosurgeon, you cannot tell like that. You have to know a lot of theory, you have to know a lot of things and get to a perfect diagnosis to operate them. So I feel like theory part, reading part is extremely important for a neurosurgeon. So it will never leave you okay. Even after becoming a consultant, they also keep on reading. They also keep on going through a lot of new papers and new techniques. This is ever evolving branch. Uh, and
Yes, sir.
another part,
Sir,
what did you ask? Sorry, I forgot.
no, no, sir, you can just, I thought you ended. You can just say, although you can.
Yeah, no, no, no. You were asking something else also. I can remember the question. Sorry,
Yes,
I
I just
forgot.
want to add on to this, so during your MBBS time, did you used to read like this, or did you develop the habit during your time, or right now after entering your PG?
No, during MBBS time, basically we have fixed hours of learning, so we can plan and read. We can plan for 10 hours of reading and 12 hours of reading, and we can keep on reading. In neurosurgery, basically you cannot dedicate your time to reading. So when now in neurosurgery, what now I generally read is if I am sitting in the OT, anesthetist is intubating the patient and preparing the patient. That half an hour I will read some topic. Then after case is over, I will sit down again with my iPad or my phone and read again while shifting out the anesthetic extubating the patient, or I'm say waiting for some CT of the patient. So that one difference is there. And about like preparing yourself for this new surgery, it's like say reading, like you have to uh, keep on reading and updating. That mindset has to be there. Apart from there, like MBBS, after MBBS, when you come into this, you can develop your own habits. There's nothing like we have to, you know, be a particular type of do a particular type of things in MBBS.
Yes, sir. So one more thing is that I think you are the first person that I'm meeting who took a 6 year course after MBBS. So how did you come to that decision? Because I also wanted to know personally, like after completing 5 years of MBBS training, again going into a 6 year course with combined MS and MCH. So one of the problems with that course is that once you lock into that, there is no going back because you are
Okay.
already
Yeah.
getting neurosurgery in mind. So how did you choose that? I wanted to do neurosurgery and dedicate 6 years of my life again to training after MBBS.
So see, basically neurosurgery training requires almost 8 to 10 years. So if you start from this like 6 year course, then maybe first year is more about general surgery and accommodating to our like residency life and all. So at least 5 years you can spend into neurosurgery in this 6 years course. So after coming out, maybe 3 4 years out of that, you can tell like yourself as a complete neurosurgeon. You can become complete neurosurgeon. Um, but if you choose a 3 years course, one thing is like you have to give the another exam, and like you spend your 3 years into general surgery, plus maybe 1 or 2 years doing the bond SRC and preparing for exam. So those 4 years, I feel is like almost not that much reliable in your neurosurgery learning process. Yeah, you can learn a few basic surgical skills and all, but still, it's like doing general surgery is completely different from what you do in neurosurgery. It's all microscopic work. So that's why I feel like it's if you are 100% sure, then it's a waste of time to go and do a general surgery. 3 4 years you spend there and then come to neurosurgery. But as you rightly pointed out that once you choose a 6 years course, there is no going back. So if you are even 99% sure, I will prefer someone to choose 3 years course and then choose that branch. But if someone is 100% sure that, if I was like a person by coming to like internship, I could never imagine my life without neurosurgery. I was that much passionate about neurosurgery. So if someone is that passionate, then fine, neurosurgery is the goal, and 6 years is the best course. For even other branches also, maybe plastic surgery or cardiothoracic surgery also. If 6 year, like you are 100% sure that you want to do this thing only in all of your life, then you can choose this course. Otherwise, if you have doubts, better to go for 3 years course and then find out, confirm your interest, and then go into particular branch.
Yes, sir. So, was there any like when you choose colleges after your MBBS? I think most of the people here also would like to know. Like, was there anything in your mind that you chose Jubilee College in Kerala, or what was going through your mind during that time when you were choosing colleges for your
There was
MBBS?
no particular mindset about choosing a college. Uh, like most of now there are a lot of colleges in northern part of India also. When I took admission in 6 years course neurosurgery, that time only there was one college in Delhi, one in Mumbai, one in Pune, and all other are from four of our South Indian states. So it was all same for me. All four South Indian states are same for me. Whether I go to Bangalore or Hyderabad or Thrissur, it was all same for me. So there was no particular order. Actually, I just found out about colleges and based on my instinct, I put Jubilee. And when I came here, I liked the department. I liked the I talked to the consultants, and I stayed here. Sometimes it's more about destiny that brings you to a particular college with particular people.
Yes, sir, yes, sir, exactly. So, sir, is there any advice you'd like to give the students, I think, in this meet, who are, I think we have students from first year to final year. So, any advice you'd like to give the people who wants to take up neurosurgery or any surgical branches in the future?
Yeah, if you want to become a surgeon, I'll tell one thing for sure, like you have to be tough person. That's the only quality you require in before you enter the surgical field. Other things will come to you, but you cannot like give up. You cannot lose hopes. So if you want to choose a surgery, okay, you come into surgery. Toughness will give you, like the residency life will itself will make you tougher, but physically. But mentally, you should be tough that you want to do it and you are ready for the challenges. And if you have interest in surgery, then only you choose surgery. That's what I'll tell. Because other branches, I think people can settle even they don't like the other branches. They can gradually they can learn how to live with it. But surgical branches, it require a lot of dedication. So if you are type of person who want to go home and get freshen up, then this is not for you. If you can enjoy your work and you can get freshen up inside the OT, doing the OTs, you can get your mind freshen up. Then this is the branch for you.
Yes, sir. So, I think I have asked enough questions. So, I think we can open the floor to audience questions. I'll also be asking questions from the Google form which we have sent. So, if
Yeah.
anybody has a question, they can ask. They can just switch on their video and ask the question.
Hi, sir.
Hello.
It was actually a great session, sir. Actually, it answered, I think, most of our questions which we had in our mind. So, regarding this, I have one small question, if you would like to ask.
Yeah.
So, my question is, so what was the most emotionally difficult moment you faced during your residency, and how did it change the way you approach the patients? So, was there any particular case as such which changed you from that point onwards?
Yeah, there are few cases. One day, in my first year itself, uh, I was dealing with a patient in ward. I thought I took initially everyone will take it as a casually, like okay, patient is complaining of something. There might be something, and then we lost the patient because of taking it casually. Maybe we might not be able to not save him if I acted immediately, but like I was not able to identify that it might be a problem. So patient was complaining of some headache and those type of things, and suddenly we lost the patient. So that day I was uh, I was very emotional, and I understood one thing that in neurosurgery you are dealing with people's patients' lives. So you can never take a single complaint or single small thing also lightly. Another incident I will tell, like one day we had five cases, emergency cases on a trot. Like one case came. We came out of the OT, thought, okay, we'll have food and sleep. Another case came. Another case came. Next day, a few like elective OTs were there. When we came out of elective OT, another emergency case came in between, and I was for like around 24 to 26 hours inside the OT. I mean, not continuously, but coming inside the OT, going for food, coming again to back to OT, and not actually going to home and resting. So that day there was one case where patient was on dual antiplatelets and elderly patient with a lot of bleeding, intraopic. Like we hardly could control the bleeding, and we we almost knew that we'll lose a patient. But after getting that patient out, immediately another child came, and that day I understood that if I am like I was feeling very bad about that elderly patient we just operated. But if I mind that feeling, if I keep that in my mind, and if I go to another OT for the child, then it's a disaster because every patient is a new patient, and they come with like new possibility of saving lives. Sometimes we are successful, sometimes we are not. But as a doctor, we are always like we'll give maximum to our one patient and go to next patient with again our 100% of efforts. So that day also was one of the days where I was very emotional, but understood a very important lesson of my life that every patient require our full energy, 100% of our efforts, without being so much emotional about any particular event.
Yes, sir. Thank you for answering the question. So if anybody else ask any question, you can ask. I think I'll ask one question. So why did you choose India as such and did not choose abroad? Why do you want to stay in India?
Mm. The biggest factor is my family. Like my parents, I know they won't be able to settle outside the India, and religious purpose also. I'm a religious person, so like I know that I won't be able to follow my religious practice outside the India. That's one of the factors. If I strictly talk about medical terms, then one of the things I love about Indian medical system is like I will share one example. One of my friend just recently went to UK, and there was a patient like 68-year-old male with multiple comorbidities, came with a chronic SDH. And they told, okay, he has a multiple comorbidities, so we can't operate him, and they just left him for dying. Here in India, we have done 95-year-old male with a chronic issue operated on him, and we have saved him. So the one thing I find good about Indian medical system is it is very much accessible, even though there are a lot of this lack of infrastructure and lot of other issues are there in India. But ultimately, I feel like if you go for like if you want to take MRI, you go to meet a doctor in the morning, and by afternoon you will have the MRI and diagnosis. Maybe next day you can get operated also. That much excess of medical facilities, I think it's very rare. So that's where I feel like we can create a lot of difference also because as I told, like EDH patient, we take them up for surgery within 35-40 minutes. What if they take like 4 hours to take a CT? They will die before CT is taken itself.
Yes, sir. That is also one more factor with abroad. So I
Yeah.
think we have a question in Google Forms. So the question goes like this: if you could give one piece of advice to your younger self in MBBS, what would it be?
Mm, yeah, I think only advice I will give to my younger self is like this NEET PG, worrying about NEET PG and a lot of future planning worrying about which institute to get into. Like I was very much into NIMHANS. Always while doing MBBS, I was like, I want to go into NIMHANS, like that things were there. So what I want to like definitely if I would have been into NIMHANS, I might have learned a different skill set and something might be different. But in the at the end of the day, I think like every institute has enough for you to learn more than what you can learn in your 6 years or 3 years course. So I feel like I would have taken it little more lightly and so all the MBBS I'll tell like you run after your dreams, you try maximum to achieve your dreams. But don't think that some particular endpoint, like you want to go into a particular institute or you want a particular rank, like below 100, below 1,000. And that's where life will get you to success. You put your maximum effort and chill and enjoy, sit back and enjoy the show. Whatever happens, destiny will take you to the best of your best of the place.
So does anybody else have a question?
Hi, sir.
Hello.
Uh, it was a very great session, sir. So, since AI is rapidly developing even in medicine, do you think it can replace neurosurgery in the upcoming years?
Not at all. I don't think it can replace anything at all, even radiology or anything at all. Because see, AI, in my opinion, AI is bound to, work in an ideal situation where everything is ideal. You give him commands and you give him experiences, and they will give you the knowledge according to that. But when I'll share one of the examples with you. We are operating on one patient with a AVM and aneurysm one day. So we first had to clip the aneurysm and then plan was to excise the AVM. So while dissecting around the aneurysm started bleeding. And when an intra-op aneurysm rupture happens, it's like a disaster condition. Almost you can like rarely save the patient. But my consultant, they are very much experienced, like more than 20 years. So he was very much calm and cool, and he tried a lot of things, and but he could still like achieve the bleeding control in after 13 minutes. In 13 minutes, patient lost 2.5 liter of blood intraoperatively. And his ejection fraction was just 35%. His BP went up to 30. Yeah, systolic BP was 30 mmHg. But that patient survived. We just stopped the bleeding, stopped the surgery that day. Again, re-exploration we did another day. And again, one more surgery we did on him. I think after now it is 6 to 8 months after this surgery happened. And he's completely fine. He's independent, walking, talking. He is going back to his job. So what I feel is like AI will never be able to replace that kind of situation where your human mind can work and like in the chaos. That type of things AI can never do. Maybe technically, okay, they might be become better than human beings because they might have more of a knowledge, they might have more of information, but applying that information into practical situation, I don't think, however it grows, even after 100 years, I don't see AI operating, on patients without human help, human command. They might be precise in surgical field, but without human being there, I don't think it is going to be anywhere in the future.
Anybody else have any questions?
So thank you for the insightful session. I had a question. As you have mentioned that during residency the hours were really hectic. So my question was, how many hours of sleep does a neurosurgery resident realistically get during busy rotations? And also, does that affect patient outcome? Does less sleep affect patient outcome in neurosurgery?
Yeah. So generally, when you are in first year and second year, you have to develop habit of sleeping whenever you get time to get yourself freshen up. So in between, like the patient is waiting for a CT for 15 minutes, you go and sleep. That's how we used to practice. So ideally, I used to get around like 5 hours of sleep on an average. Some days it may be extend up to 6 to 7 hours. Some day it will be 4 hours. Some day no sleep like that. But for 5 hours around sleep, you will get on an average 5 to 6 hours. Okay. And other part, does it affect patient outcome? I don't think so because training when you are in the beginning, you are not doing that much of direct means you are in a first year you don't go and operate by yourself. So that training takes time. So while you are getting trained and your seniors are operating, you also get habitual to the workflow and all these things. So if you have mental capacity of mental preparedness that okay, you are ready to do your work, then that won't affect the patient outcome because physically your body will get trained. Another thing is when there is a surgical case comes, emergency surgery comes, however sleepy you are, if you are interested into neurosurgery and you really want to save that patient, then your all sleep will go away. You will just run to the hospital, go and operate. You won't feel anything. That power, it's not power of adrenaline, I won't say, because it's a fight and flight. It works for some time only. But I don't know what it is, but it gives me power. Whenever I'm so much tired, I will like I don't want to. I can barely open my eyes. But there is some case, but some so junior calls me that there is a case, some cases there, so you come. Then I go and I operate for 4 hours. I don't feel sleepy at all. Maybe after the case again I'll be dead tired. But so that is more about mental preparedness rather than physical endurance. Physical endurance will come with time.
Okay, sir. Thank you.
Anyone else has any questions? You can just unmute and ask.
Sir, I do have a question.
Yeah.
So, looking back at your journey, like what are the most important skills or habits a medical student should develop early if they want to become a good neurosurgeon?
Only thing is, I told earlier, so toughness, never giving up attitude. That's all. Other all habits and skills you will develop later. Yeah, one thing I feel important, important is you can develop is writing using your left hand. That I found very difficult in the beginning of my residency because in a surgical skill you require your non-dominant hand also a lot to do a lot of different type of maneuvers. So maybe that is a one thing, but that can be developed after also. But if you are very much like sure that you want to become a surgeon, maybe you can develop that skill early. Otherwise, just that mental toughness is the only thing I will tell that you should be prepared that okay, I want to do it, and other things will come automatically.
Thank you, sir.
So I think I'll ask one more question. So during your time, during your residency, during your internship, especially during your residency, you might get a lot of cases. As you told that it's a branch where there's high mortality is there. So what you must see a lot of deaths during a day. So how do you just keep on going from one death to the next case? Because the next case can come just right after one death has happened. So how do you cope up with dying patients? You are not able to do something because it's not always that you can intervene and save their life. So how do you not let death numb you basically during your residency during any time of your life?
So it's more about like having a hope of like saving a new life more than like it always hurts. Like sometimes one patient dies, next patient come, we go and like operate on next patient and save their life. But after both the cases are over and we come back home, we feel very sad because of that lost patient. But when we are in the department, we are working with the patients. At this time, I think what drives maximum is like the hope of saving the next patient. Because and one thing is acceptance. When we are in a branch like neurosurgery, we have accepted the fact that there will be patients we won't be able to help much. So it's more about training your mind in a way that you can cope up, okay, with whatever you can say, whatever you can do, you do. Some parts we are not good. We are just the human beings working towards some goal, and we can do as much as we can do.
I would really like to thank you, sir, for accepting our invite. And I know you are a busy person and you might
Yeah,
not have sleep also. So thank you for coming and talking with us. And thank you for taking the questions. So we'd like to thank you from Sign as a whole. Thank you, sir. Thank you for coming.
yeah. Thank you for inviting me, and you can share my details to the people, like maybe Instagram ID or phone number also, whoever wants. Uh, can always come and talk to me if they have any doubts or anything. And all the best to everyone for your journey. Thank you for inviting me.
Thank you.
Thank you, sir.
Thank you a lot, sir.